Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Diego Hijano. He's a pediatric infectious disease physician. Today's Kevin MD article is How Humor Builds Trust in Pediatric Oncology. Diego, welcome to the show.
Thank you so much for having me, Kevin.
All right, so let's start by briefly sharing your story and journey, and then we could jump into your Kevin MD article.
Yeah, thank you. So I'm as you said, a pediatric infectious disease physician. I'm originally from Argentina in South America. So I grew up on a small city on the Atlantic coast. So, I had a great sort of upbringing, but as I was heading out to med school, I lost my parents in a car accident. And so, that led to a very difficult times during med school. But, my older brother sort of took over and he was in law school, and my younger sister was finishing high school. So you could imagine, three sort of teenagers found in that situation. But I think, a lot of people always say like you were sort of brought up to face that situation. We were independent, and my family was very supportive, obviously. And so I ended up going back to med school right after the accident, and finished med school and decided to go into pediatrics. I didn't know that ID was going to be my sort of specialty. I just always thought of adults. Pediatrics was completely out of my radar, but I completely fell in love with it. I completed my residency there in Argentina in a big pediatric hospital, and had an opportunity to experience some research during residency from a nonprofit organization in Buenos Aires. And I felt like that was a really cool way of practicing medicine and impacting more patients. So I got an opportunity through them to come to the US. So in 2011, I moved with my wife, a 2-year-old daughter and 3-month-old baby to Nashville, Tennessee. I spent a few years at Nashville. I did all my steps and then ended up coming to St. Jude for my fellowship. And I now a faculty that do mostly transplant ID here at St. Jude.
All right. So your Kevin MD article is titled How Humor Builds Trust in Pediatric Oncology. For those who didn't get a chance to read your article, tell us what it's about.
Yeah, so, I'm obviously, you can notice I have an accent. So when I came to the US and started practicing, I noticed that a lot of stories were coming out from encounters with patients where I would say a word and they will understand something different.
Yeah.
And so I would always open up, with my last name is very difficult. People here it says Hijano, Hijano, Hijino. So I say I'm Dr. Hijano, but I go by Dr. Diego, like Go Diego Go, Dora's cousin.
Yeah.
And it's fading away now where people are not that familiar with Dora the Explorer and Diego, but over the years, most people will relate to that. And everyone would laugh and it would be sort of an icebreaker. People will remember the name. And so, that connection to me was very important. So, I started telling these stories to colleagues, or like, this is how I introduce myself, and it completely changed the environment. Or, one time I was rounding late at night, and I always say the tongue is a muscle, so it gets tired. And I was with the family, so I was introducing. I say I'm Diego, like Go Diego Go, and like do you I have this baby shower with me, and just like what you are talking about a baby shower, and so everyone was laughing out loud, and so. These stories every time I tell them, resonate with people. So I figured it was time to try to put them all together and share it with the rest of the community.
So you obviously, like you said, work at St. Jude's Children's Hospital, and that's of course a place where the sickest children from around the world go to, right? And these families are under a tremendous amount of stress, of course. So tell us how these small moments of humor, how does that help you build connection with these patients and families?
Yeah, that's very important. We obviously have a workplace where kids die every day because of their disease, no matter how much you do. And I think, throughout the journey of chemotherapy and transplant, there are a lot of ups and downs. And I think, we come to a place where we know that sometimes there is nothing to do, or we just don't have anything to offer but our presence and our connection. And sometimes, these moments that most of the time were unintended, and now, I do it more intentionally, were really, really a sense of for families to also relax and release some of that tension by being able to laugh at their doctor or with their doctor from funny stories or things that were more personal. So I think this connection of showing that we are vulnerable and that we can laugh at ourselves and make mistakes has really come a long way in families sort of seeing me as like, oh, he's a regular guy just like me, and this was funny, and that releases some tension and takes you out from that heavy moment that you're going through with your kid being so sick.
Now, have you always been like that from a personality standpoint? Have you always had that personality where you would find humor in more situations, or is this something that you said that was more intentional?
Yeah, so reflected a lot on this because certainly during med school and pediatric residency, following the accident with my parents, I was pretty angry for a long time. And people will define me as like either people love you because you are great and super supportive, or people are afraid of you. So I will have this sort of like Dr. Jekyll, Mr. Hyde, Dr. Jekyll situation, and I think by encountering patients and going through these situations, it sort of reflected on, this is who I used to be, and this
Hmm.
is who I want to be, and I don't need to be that angry person or that sort of person that just goes through the day without engaging. And sort of it was a way to also connecting back to what my true self is, which is someone that can reach out and be humble and say, yeah, this is who you get as a doctor, and I'm not perfect, but I'm here for you, right?
And I think that point is really important, like showing sometimes that vulnerability and showing that human side of you, especially at a place like St. Jude. And as you mentioned, these families are, these patients are among the sickest in the world. Sometimes can help with that connection with patients, just showing your humanity.
Yeah, absolutely.
Now, what advice do you give to clinicians who may feel a little bit hesitant about using humor because they're afraid of saying the wrong thing? As you know, we live in a society where sometimes if you do say the wrong thing, you're going to get punished for it. So what do you say for those physicians where humor does not come naturally?
Yeah. So I think, I start by sharing personal stories, like we all have a story to tell. And I always talk to trainees and young faculty, you have a story, you've come a long way. You are from somewhere, you grew up somewhere, and you had your parents or not. And so just tell a story of something that is relevant to what's happening. Just go ahead and share that with them. And that's, it's sort of the first step. And humor may not come out of it, but the connection will be there by just sharing something personal. So at the end of the day, for me, humor it's a way of connecting because of my accent and my sort of nationality and ethnicity. But sometimes I connected with patients through storytelling, through, I hear you, my daughter, with COVID vaccines, it was a huge deal where people were so afraid. And, I was, last week I took my daughter through the drive-through and she got her vaccine because now she was eligible. And these were her concerns and these were my concerns as a parent. And this is how we discuss about it. And so sometimes, even beyond humor, start by just being authentic, being you, and tell them something about you that they may not know. It could be, your favorite ice cream flavor or what you like to do on the weekend, or like it just has to be something personal.
In your article, you talk about Danny Thomas and his vision for St. Jude. So, how does his legacy influence your daily practice as a physician?
Yeah, so to me, it was sort of kind of a serendipity moment, when I was writing about all this and how, I ended up working in a place where it's so special, but also studied by, a comedian who understood that, laughter was a way of getting together, of healing us. And, he's obviously has a very rich ancestry and has been able, to multiculturally put this place together in Memphis. And so to me, he's a great inspiration of not only what you can accomplish, but what's important, which is we want to make people feel better. So not matter, they will not maybe remember you, and that's not the point. They will remember how you were treated, how you made them feel. So just, do your best to make people feel better. And that's, you cannot go wrong with that.
We're talking to Diego Hijano. He is a pediatric infectious disease physician. Today's Kevin MD article is How Humor Builds Trust in Pediatric Oncology. Diego, we'll end with some take-home messages that you want to leave with the Kevin MD audience.
Well, I think the most important thing for me is that, in a world where everyone is seeking perfection and everyone is looking at the little details or where you are missing it to call you out, just get rid of that burden. We don't need perfection. We just need, to be present. And in this day and age where, everyone is multitasking and doing so many things, for us as physicians entering a patient's room, it's sort of a sacred space. It's the one place where it's about the patient. So, take advantage of that moment, be present and be yourself and tell your story. Don't seek for perfection.
Diego, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much for having me. It was a pleasure.